Hi everyone, this is Hritik Savla. Today I will be discussing the most important topic for the university exam, which is the blood supply of stomach. Stomach is a muscular bag forming the most distensible part of the digestive tube. It lies obliquely in upper and left part of the abdomen, occupying epigastric, umbilical and left hypochondriac regions. External features include two orifices, cardiac and pyloric, two curvatures, lesser and greater curvature, and two surfaces, anterior and posterior. The lesser curvature is concave and forms the right border of the stomach, giving attachment to the lesser omentum. The greater curvature is convex and forms the left border of the stomach, giving attachment to the greater omentum. Now let's first look at the celiac trunk and its branches. Celiac trunk forms three major branches: the left gastric artery, which is the smallest branch, common hepatic artery, and the splenic artery, which is the largest branch. The left gastric artery reaches the cardiac end of the stomach and runs downwards along the lesser curvature. It ends by anastomosing with the right gastric artery. It gives off 2 to 3 esophageal branches at the cardiac end and numerous gastric branches along the lesser curvature. The common hepatic artery runs as hepatic artery proper after giving gastroduodenal artery at the upper border of the first part of the duodenum. The gastroduodenal artery divides into two branches: the right gastroepiploic artery, which follows the greater curvature of the stomach and anastomoses with the left gastroepiploic artery, and the other branch is superior pancreatico-duodenal artery. The right gastric artery arises from the hepatic artery proper and runs along the lesser curvature to anastomose with the left gastric artery. 5 to 7 short gastric arteries arise from the terminal part of the splenic artery and supply the fundus of the stomach. The left gastroepiploic artery also arises from the terminal part of the splenic artery and follows the greater curvature of the stomach. Here is the dissection specimen in which you will very well appreciate the celiac trunk with its branches supplying the stomach. First is the left gastric artery, which gives off esophageal branches at the cardiac end of the stomach to supply the lower part of the esophagus and the upper end of the stomach, and the gastric branches which supply the anterior and posterior aspect of the stomach along the lesser curvature by anastomosing with the right gastric artery. Second is the common hepatic artery, which gives gastroduodenal branch and continues as hepatic artery proper, which in turn gives right gastric branch, which anastomoses with the left gastric artery. The gastroduodenal artery divides into its two terminal branches. First is the superior pancreatico-duodenal artery and the right gastroepiploic artery, which is also known as gastroomental artery. Third is the splenic artery, which gives off short gastric branches, and the left gastroepiploic artery, also known as left gastroomental artery, which anastomoses with the right gastroomental artery to supply the anterior and posterior aspect of the stomach along the greater curvature. So now let's see the venous drainage. Right and left gastric veins drain in the portal vein. The right gastroepiploic vein ends in the superior mesenteric vein, while the left gastroepiploic vein and the short gastric veins terminate in the splenic vein. Now, let's come to the most important part of the discussion, the applied aspect. Bleeding peptic ulcer is bleeding from duodenal ulcer or gastric ulcer or the stomach ulcer. In bleeding from stomach ulcer, partial gastrectomy is required. Gastroduodenal artery ligation is required in case of severe massive upper GI duodenal ulcer bleed. To summarize, we have learnt about the location, structure, blood supply of stomach and its applied aspect. Lastly, I would say eat healthy and stay healthy. Thank you.